Well, hello. It's another beautiful day down here in Bethesda, Maryland, but unfortunately, we're sheltering indoors, so we don't get to enjoy it. But at least we can enjoy a Gross Path Challenge. Here's Gross Path Challenge number 59 coming at you. Slide number 1 is tissue from a Canada goose. Can you give me a morphologic diagnosis and a cause? Okay, time's up. We actually have several small lesions, 1, 2, 3, and then this very big lesion on the bill. Now, it could be some type of tumor, but whenever I see any lesions on the non-feathered skin of any avian species, I'm going to think about avian poxvirus, and that's exactly what this is. And poxviral lesions of the skin, once again, in any species, all have the same morphologic diagnosis. Doesn't differ whether it's a bird or whether it is a monkey or whether it's a sheep. They're all proliferative and ulcerative dermatitis. There certainly is a lot of proliferation going on here, not so much down here. It tends to be spread by biting insects. And the proliferation in the skin is primarily within the stratum spongiosus, massive acanthosis. And if you took a nice histologic section of any of these masses and you look at that layer of the skin, the cell's going to be really, really swollen, and they're going to have these beautiful intracytoplasmic inclusions characteristic of poxviral inclusions. And in birds, and only in birds for some reason, we call those Bollinger bodies. So avian poxvirus, for any proliferative lesion of the non-feathered skin of birds, that's what you want to think about first. Okay, here's a classic. I love these old pictures. They're like old friends, and it's great that on a Saturday afternoon I can spend time with my old friends as well as some of my new friends out there. And this one goes a long way back. It's a beautiful picture. It is from a horse, and I need a morphologic diagnosis and a cause on this one. Okay, time's up. We are looking at the renal pelvis, and a significant portion of it is greenish. That's not right. Okay, the rest is somewhat hemorrhagic. And remember, we've talked about usually when you see hemorrhage, you want to think about necrosis because it often, the dark color of the blood often masks the blanched out color of necrosis. So this is multifocal to coalescing renal papillary necrosis. And when we think about horses, first thing you want to think about are non-steroidal anti-inflammatory drugs. Back in the day, they were a lot more harsh than the newer generations are, and drugs such as butazolidine and then its successor phenylbutazone really did a lot of damage when they were given to animals in excessive, and then for some animals even normal doses. The blood vessels which supply this part of the kidney, the vasa recta, are the wimpiest blood vessels in the body, and they need to maintain a constant level of prostaglandin E2 and I2, which is produced by interstitial cells in this area of the kidney. And what happens, these non-steroidal inflammatory agents inhibit COX-2. They prevent the production of prostaglandins, and those vessels say, no prostaglandin, I'm out of here. And they slam shut. And if you listen very closely to an animal who gets this drug, you can hear those vessels slam shut. And in horses, you want to look in the kidney, it's a great lesion, but you also want to look at certain characteristic parts of the GI tract, which also are very susceptible to these drugs. You can see ulcers in the mouth, you can see them in the esophagus. You very commonly will see them in the stomach and in parts of the colon. The intestine is often affected, but the colon, especially the right dorsal colon, are very susceptible to non-steroidal inflammatory drug toxicity. Slide number 3 is tissue from a pig. Can you give me a morphologic diagnosis and 2 possible causes? Okay, time's up. We're looking at the spiral colon. We've made several incisions in the spiral colon, and then you can see this hemorrhage. Remember, hemorrhage equals necrosis in almost every case, very few strictly hemorrhagic diseases. And it's sort of gooey and necrotic, and it's the colon. So when I see necrosis in the colon like this, I want to think about a condition which is known as swine dysentery. Swine dysentery affects the colon and can be very superficial necrosis of the mucosa, or it can be full thickness necrosis. It is caused by beta hemolytic spirochetes. Brachyspira hyodysentery is the classic cause of this lesion. People used to call this Turkish towel. You can see some that have little shaggy areas of fibrinal necrotic. This one's a little gooey for that. But Brachyspira hyodysentery, the cause of VHF swine dysentery. Within the last 6 or 7 years, a very excellent pathologist from Iowa State named Bailey Wilbur has identified a second beta hemolytic strep known as Brachyspira hampsoni. I think Dr. Hampson did a lot of work early in Brachyspira. If you said Brachyspira pilosecolli, that can be identified in the colon of pigs. Brachyspira pilosecolli causes a somewhat different lesion, not quite as necrotizing, and it strongly colonizes the intestine. We can see Brachyspira pilosecolli in non-human primates as well. An EM of that lesion in non-human primates, you'll see just the entire surface colonized by these spirochetes, which are standing on end. I don't know how the animals digest anything, but this is a great picture of swine dysentery, Brachyspira hyodysentery, or now hampsoni. Speaking of non-human primates, this slide is number 4, and it is tissue from a rhesus macaque. Can I have a morphologic diagnosis and a cause? Okay, time's up. This must be a young rhesus macaque. It's got beautiful teeth. And this person is being very careful using tongue depressors to pull down the lip, and we see there is a focal ulcerative chylitis. I don't know if this animal has any other ulcers in its mouth or on its tongue or even on its genitalia. But this is a classic sign for the disease that we are so worried about contracting from non-human primates, especially macaques, and that is a virus known as macaque herpes virus type 1. It has gone by many names. Most of you may know it as B virus or herpes B virus, or back in the day when it was first identified during the trials for Jonas Salk's polio vaccine. It was the Brebner agent, and Dr. Brebner was an a pathologist who was working with Dr. Salk with these monkeys before they knew about it. And obviously he had contacted an animal, had been bitten, and the animal had herpes B and was transmitted. Problem with B virus, it is to date 70% or more fatal. And probably all the untreated cases, it turns out to be fatal. The problem with herpes viruses is when they jump species, normally in rhesus monkeys, it causes ulcers, and it's not a life-threatening disease, except in immunosuppressed animals. When it jumps species, this virus causes a tremendous viral encephalitis in humans. And so this is why we're very, very careful when we work around primates. We double and triple gloves and always make sure that we use proper PPE, and we're very careful. Every macaque should be considered and treated like it has this virus. There's no good test for these viruses because they live latent in the nerves of the face or the nerves of lower down in the spinal cord, in the ganglia. And when the animals are stressed or they're immunosuppressed, they may recrudesce, and that's when you see this fairly mild lesion in rhesus macaques, but it is not mild when it gets into people. Another great example of this sort of differential severity when herpes viruses jump species is people with herpes simplex type 1. They get cold sores when they get stressed out. You've probably seen them. But in rabbits, it causes a fatal encephalitis. So people that come in contact with rabbits when they have an active cold sore, or other non-New World primates, can cause a lethal encephalitis. So this herpes B, you got to know about herpes B if you're working around primates, and a very important disease we should all be cognizant of. Hey, slide number 5 is a goodie. This is tissue from a cat. I would like a morphologic diagnosis and a cause. Okay, time's up. We don't see this very much anymore. There have been a paper or two published within the last couple of years. Usually this is seen in neglect cases, but back in the day, this was not an uncommon lesion in cats, and especially in fur-bearing animals on mink farms and fox farms, as a result of feeding very poor diets, which had a lot of fish meal in them. Okay, so the morphologic diagnosis, we're looking at this cat. It looks pretty unkempt to me, but if you take a look, all the fat in this animal's body, the subcutaneous fat here, and the omental fat is a yellowish color because it's been oxidized. Remember, whenever you oxidize fat, it should be white, but when you oxidize it, it turns yellow. And the reason it's oxidized is because this animal's been fed a lot of fish meal, and the diet's also deficient in vitamin E. Vitamin E is a very important antioxidant and protects your fat against oxidizing agents like too much fish. And when your vitamin E and your selenium stores, and selenium is a very important cofactor of glutathione peroxidase, both vitamin E and glutathione are important in preventing oxidation of fat. If you have very low stores of that, then your fat will start to turn yellow. And these cats are generally very painful when you touch them. It hurts when you touch this area of the inflamed and degenerate fat. And when you open them up, they often smell rancid, or if they've been getting a lot of fish, they have a very fishy smell to them. The name of the disease is necrotizing steatitis, and that was named by Dr. Thomas Carlisle Jones, an old alumnus of the AFIP, author of Jones and Hunt's book on pathology, which had 6 editions. It was a classic tome on veterinary pathology. The man was a tremendous gentleman. It has been my pleasure to meet him a number of times. And one day I asked him, I said, how'd you came up with the name necrotizing steatitis? He said, well, I wasn't the first person to see this disease. The other pathologists wanted to call it necrotizing adipositis. He said, I thought that just sounded like hell. So I convinced him to call it necrotizing steatitis, and there it stands. They also used to call this yellow fat disease back in the day when descriptive names for diseases were all the rage, like yellow fat and brown dog gut and things like that. But we call this necrotizing steatitis, and it's a lack of vitamin E in your diet, with too much fish. Or at least it is for cats and for mink and for foxes. Here comes slide number 5. I hope this is a slow pitch for all of you. It's actually slide number 6. But can you give me a morphologic diagnosis? Be specific on this one. This is tissue from a horse. Okay, time's up. This mass here is a mesenteric lipoma. We commonly get little bits of fat as you get older in your mesentery that just becomes somewhat globular. When they get some mass on this, they're like a ball at the end of a string, and as the animal twists, they can sort of swing around. And what happens, unfortunately, in horses when they have these good-sized ones is sometimes that because it has a long piece of mesentery that's come down because it's gotten heavier and heavier, and then the mesentery is stretched. And what happens is this will loop around a section of gut once or twice, and it'll sort of tie itself off, and you get strangulation of this section of gut. This doesn't look very healthy, but this looks awful. And it's very dark because this is a venous infarction. Remember that veins have very thin walls. It doesn't take a lot of pressure to collapse them. The arteries have thick muscular walls. They continue to pump blood even when you're pushing on them a little bit, so it takes more to collapse. So you get this bit of mesentery, which is wrapped around, doesn't affect the arteries. They continue to push blood in, but the veins can't move the blood on. So that's why venous infarctions are very dark purple. Arterial infarctions, if you get one of those, then the tissue becomes very white and blanched, but it's a classic venous infarction. Can we put the morphologic diagnosis all together here? This is a strangulating mesenteric lipoma with venous infarction of the intestine. A perfect morphologic diagnosis for a classic lesion. Slide number 7 is tissue from a cat. Can you give me the cause? Okay, time's up. This is a great one. You don't have to have a lot of pathology training. If you have a good mind, you're going to figure this one out pretty good. This is a fixed section of intestine, and it is very plicated. And I remember way back in the dark ages when they taught us radiology in veterinary school, and all we had were dinosaurs to look at because that's all that roamed the earth when I was in veterinary school. But when you get plication, it's a very irritated gut. You want to think of a foreign body that causes this tremendous muscular contraction. And then we have this lesion right here. It is sort of a dark black that is fixed blood. We have these ulcerated areas, this linear spot here. And this is what happens when you have a string foreign body. Remember, you get plication of the gut around it. The gut is trying to squeeze it out of there. The gut's very irritated. Okay, when you have a string foreign body, you have to have one end anchored, whether it's anchored around the base of the tongue or a tooth, or maybe just caught and there's a knot in the end of it, and that's caught in the pylorus, so the rest of it is moving down. A typical piece of string or mop string, if an animal eats it, usually will move through without any trouble, and the animal's going to poop it out. Never pull that. I've seen a lot of cats with mop strings hanging out of their behinds. You don't pull it because you're going to cause a ulcerative lesion, but the animal is generally going to pass it. In that particular case, you can cut the end off so it doesn't have that running around with that hanging out of it, but you let it pass it on its own. Sometimes these animals can't pass because one end is trapped, and that is when we get this particular lesion. The intestine keeps squeezing and squeezing to move it out. It doesn't because it's anchored, and then it eventually rubs a raw hole, and then the animal will perforate and get peritonitis or something like that. The other thing that you will see histologically is a lot of times in these chronic soft foreign bodies that don't move very well, and you get all this peristalsis, you will see a thinning, an actual thinning of the muscular layer over the issue, and it probably goes through a period of mild hypertrophy, and then you end up with a thinning of the wall here. So great lesion and a fantastic picture of that. Slide number 8 is tissue from a military macaw. These are these really sort of pretty olive drab colored burrs. There's a little bit of red on them. They're military macaws. And I need from you 2 morphologic diagnoses and a cause. Okay, time's up on this one. There are a couple things going on here. First thing, I want to look at these lungs. Lungs tend to be very congested whenever a bird dies, both grossly and histologically, and there's a little bit of blood here, but I'm not gonna make a big deal out of that because you see that from time to time. Things I will make a big deal of is this very large spleen and the hemorrhage on it. Okay, remember, hemorrhage equals necrosis. This is multifocal coalescing splenic hemorrhage and necrosis. Or you can say necrotizing splenitis. I'll take that too, but it's very big. Whenever I see this, I'm pretty sure that there's some sort of disease going on in these animals. There are a couple of diseases that will cause necrotizing splenitis in birds, and they're never a good one. The other one that I want you to see that you might not have picked up is look how cloudy and sort of thickened these air sacs are. So this is a multifocal coalescing heterophilic and exudative air saculitis. And I'll just say exudative because probably that cloudiness is a combination of inflammation and some edema. The air sacs are definitely uh, affected in this particular animal. Okay, when I think about this condition, if it was a chicken or something, I might think of a couple of different viral diseases, maybe in some bacterial air saculitis. When I think about a psittacine, I'm going to think about a classic disease of psittacosis. Okay, psittacosis is caused by chlamydia psittaci. And one of the classic lesions in both psittacines and turkeys, which get this, in turkeys they call it ornithosis, is cloudy air saculitis. So that, and the other thing is you're going to see both within the spleen and within the liver, you're going to see cells, in this case, large groups of cells, which contain chlamydial intracytoplasmic inclusions. If you've got a great slide, you're going to see them as little tiny purple dots within degenerating cells. And you'll see them here in the spleen. You'll see them in the liver. The liver has been pushed out of the way. Looks like it's up here. I just didn't want to comment on that. But those are two great morphologic lesions in psittacosis in psittacines. And if you work a lot with psittacines, and it used to be a problem in the turkey or the poultry industry, but they pretty much, we don't see it hardly anymore, but you can still see the odd cases of human psittacosis in animals that, or people that have lots of psittacines. I had a good friend who actually died of this condition in his 70s, and he had been keeping a large number of rescued psittacines for many years. And he should have been much more careful. He inhaled it from their feces and should have been much more careful, and very unfortunate. He was a veterinarian as well. So psittacosis, chlamydia psittaci. Well, we only have 2 more slides, and this slide is tissue from a dog. Okay, time's up. This one, if you don't get oriented, you can look at this one for a while, but we are looking at the spinal cord right here. The dura have been reflected. You can see the exits of the spinal nerves here, probably in the lumbosacral area. And this is a condition which is known as dural ossification, or if you want to use a fancy old term, ossifying pachymeningitis. And you see this not uncommonly in older dogs, not a disease of young dogs. Oh, it never fails to get a phone call when I'm recording these, especially if I tell everybody I'm recording. Okay, so this is a disease of large dogs. It's usually an incidental finding. And what you see is you see these large, they start out as foci of mineralization, and they're usually in apposition to the vertebral body. Okay, you don't see them very much over the intervertebral space, but you'll see, especially in the lumbar spinal cord, these plaques of mineralization. And then as time goes by, the animal this will actually turn into bone. It'll organize, remodel, turn into bone. And then because it's bone, you will have colonization by bone marrow precursors. So these are actual plaques of marrow-containing bone within the lumbosacral dura of an old dog. So there's something going on here in the spinal cord as well. But I can't tell you what it is. It's probably an old working dog. There's an old AFIP slide, maybe an old working dog with some sort of trauma, or degenerative myelopathy, which usually doesn't cause hemorrhage like this. So that I can't tell you, but this is the lesion that I want you to focus on and remember that. And then finally, here's our quarantine special, slide number 10. And this is a fish. Probably somebody out there knows what kind of fish it is. Looks like salmon of some type. But this fish needs a shave and it needs a haircut. And can you give me a morphologic diagnosis and a cause? This fish has been in quarantine like we all have for a while, and it needs to see a barber, I think. Okay, time's up. Now what I want you to see is every place where we have this sort of fuzzy growth, there is redness. And if we were to scrape this off, you would see that these are areas of ulceration. That's very important to the pathogenesis of this particular condition, because this animal started with some sort of ulcerative dermatitis, whether it had been rubbing on the tank, whether it had been a bacterial infection, of certain types of viral infections. I don't know which one, but it's not the point of this slide. Even here where you have a little bit of ulcer, you got some of that fuzzy growth. Okay, so the morphologic diagnosis, multifold coalescing ulcerative dermatitis with fungal hyphae. And the cause is Saprolegnia species. Saprolegnia is a common mold in water. It is an opportunist. There are many different species, so I just call them all Saprolegnia species. Condition is known as saprolegniasis. And you see this in animals that have a pre-existing dermatitis. If the animal has healthy skin and scales, you are not going to see this. It's only in the area. So it's an opportunist that takes advantage of ulcerated skin, and then it grows. You can see this in fish. You can see this in amphibia. You can even see this on eggs. Fish eggs can have saprolegnia species growing on top. So this is etiologic diagnosis would be cutaneous saprolegniasis. And you see it in animals that have ulcerative disease, usually in sort of poor water quality. Well, that was fun. That brings us to the end of Gross Path Challenge number 59. Hey, we're going for number 60 tomorrow. Hey, I hope everybody is indoors. If you're not, then you're being very careful. Wear your mask, stay safe, and I'll see everybody tomorrow.